Hey, Edson, Mayor Kevin Zahara with another Town of Edson COVID-19 update to run through the numbers here over the weekend. Nearly 3,000 cases across the province. Broke a threshold on Saturday with more than 1,000 cases identified. Another threshold broken here with the latest update with 10,031 active cases across the province. 860 new cases in the last 24 hours. 264 in the hospital, 57 in the ICU, and the real horrible number that was shared with us with the latest update. We've had 20 Albertans that have passed away in just the last 24 hours from COVID-19. Hospital capacity is the biggest concern right now, with hospitals being overwhelmed with what's going on. We have healthcare workers that are in quarantine that have been impacted. We have wards being closed because they have infections, and then the sheer cases of the public being infected and ending up in hospital in the ICU. We have 70 beds dedicated to COVID-19 in the ICUs across Alberta. 57 of those are currently taken. We have huge outbreaks in a number of seniors facilities. And right now, the rate of positivity in testing is 7%. Earlier on, just a few months ago, it was less than 1%. So there's a lot of concern with what's going on in our healthcare system. This is no longer about believing whether or not COVID is true or not, what masks are beneficial or not. This is about protecting our healthcare system, and we already know that rural patients, so you have a situation here in rural Alberta, you need to be transferred to Edmonton. That may not happen because there aren't beds available in some of the city hospitals. A doctor from Hinton posted on the weekend that a patient of his was unable to be transferred right away. As we know, in emergencies, seconds count, hours count. And if somebody needs that critical care that they can't receive in a rural hospital and they can't get a bed in Edmonton, that could be disastrous. Likewise, surgeries. There are a number of surgeries that have been canceled, about 30%, I believe, of non-urgent surgeries have been canceled. These are people that have been living with pain, that may need things like a hip replacement or something. They can't get that surgery now, and they've been waiting. They've been waiting, and now they don't know when that's going to happen. And then that could lead to other healthcare issues. So we really need to do our part to help our healthcare system. And I want to thank all of our healthcare workers that are just so tired and exhausted over this. I know I'm exhausted. I'm tired. I know you're tired. Think about our healthcare workers that have to wear full PPE, that are going into the danger zone day in, day out, and feeling like people are just not listening to the message. I don't care right now if you believe in masks or you don't believe in masks. I don't care if you think this is a scam-demic, that this is about government control. People can have their opinions and think about the conspiracies. At this point, I really don't have time, and I don't care about that. What I do care about is making sure that those that need a space in our healthcare system have it. And right now, they don't, because we have a healthcare system that is literally at a breaking point. I also care about our seniors in our seniors facilities. My worst nightmare that it keeps me up at night, and I'm being absolutely serious about this, is thinking about this getting into our seniors lodges, in our seniors apartment buildings, because we know the outcomes are not great. And we've seen that in facilities across this province. And we need to do our part. We all need to step up. I've been wearing masks more. I've been in it. And the mask thing, it's a piece of the puzzle. It is not the be-all, end-all. But if we are all taking all the necessary steps of hand sanitization, physically distancing, staying home if we're sick, wearing masks, and please, for God's sake, stop hosting parties right now. That is, we know 40% of the spread is because of social gatherings. Now is not the time, because our healthcare system is at a breaking point. Our economy could get shut down because we cannot sustain our healthcare system. And how to get things back on track are taking the mandatory and the voluntary measures seriously, whether or not we like them. And so let's all do our part. I want to thank all those that have been stepping up and doing their part. So many people. We're all tired. We're tremendously tired of this. And I also want to thank our workers in the Evergreens Foundation, Parkland Lodge, those working with our seniors in our most vulnerable populations, people working in the McMahon world and scope. Thank you for all you're doing to help those that are more vulnerable than, say, people like me who are a little bit younger and maybe a little bit in better health or maybe not so better health. Thank you for all you're doing. I know how exhausting this must be for you. And let's all do our part. Now, I'm going to just want to run through the regional numbers here. And Edson, you're really doing a great job, because I looked at the regional numbers and Edson has the lowest amount of cases to date. Unfortunately, that the numbers have increased here in the Edson region to 5 active cases. We've had 10 to date. However, regionally, we're doing very well. In Jasper, they currently have 9 active cases. They've had 40 active cases throughout this pandemic, 40 to date, I should say, 9 currently active. Hinton currently has 9 active cases. They've had 21 to date. Whitecourt currently has 18 active cases, 26 to date. Their mandatory mask bylaw passed today and is currently in place because of what's going on in their community. And I say kudos to their council. It's not an easy decision to make, but necessary in what's going on. And one of the discussions they had was about protecting some of their larger employers, because if it gets into a shift, say at the mill, they lose a shift. They could lose all their workers for that shift, which costs people money, which costs the mill money, which could lead to further shutdowns, further restrictions. So that's what masking is about. It's about trying to prevent that from occurring. Drayton Valley, Brazeau County currently has 24 active cases, and they've had 37 to date. Grand Cache, 4 active cases, 11 to date. Yellowwood County as a whole, which includes the Edson number, currently has 12 active cases and 36 to date. Edson currently still on that watch list. So let's continue to do our part, Edson. The Emergency Management Advisory Committee of Council will be meeting tomorrow afternoon at 5 o'clock to get an update from our Emergency Coordination Center on what's going on. Of course, we do have our mandatory mask bylaw that is passed. It hasn't been enacted as of yet. There's a number of criteria that need to be met, but within that bylaw, the ECC, the Emergency Coordination Center, which is our officials, our administrators in emergency management, they make the call on when that bylaw gets enacted. It's not a decision of council. It's our Emergency Coordination Center. And some of the criteria are looking at the regional numbers and what's going on provincially, as well as what's going on here locally. And we have 5 active cases. We hope that those that are impacted with those cases have a very speedy recovery. Our thoughts are with you. And I know it's probably really scary for the people that are dealing with COVID right now, but you feel no shame and just hope that you get well very, very soon. I know that they've been out there contacting those that they've been in contact with. So we may see those numbers increase or maybe not over the next couple of days, but we'll certainly keep an eye on that. As I mentioned, the Emergency Management Advisory Committee of Council will be meeting with the ECC tomorrow to get an update on what's going on regionally and provincially and discussing what's happening. I just want to throw out there that we may see masks here in our community sooner rather than later based on what's going on provincially and regionally. And it's all about protecting our most vulnerable and our healthcare system. And it's not a decision that's going to be taken lightly. When we passed the bylaw, it was not an easy decision to make because we know that people are not necessarily in favor of it. But at the end of the day, we're tasked with making a decision for the community as a whole. I would really have hoped that the provincial government, who is the experts in healthcare, mandate these things provincially and not leave it up to municipalities. But they have, and so we've been tasked with making those determinations. And Jason Kenney, our premier, has spoken that further restrictions may be coming if we don't get control of this. So let's all do our part. Let's continue to work together and support one another. And please be kind to one another. We're all tired. I'm exhausted with COVID. Our healthcare workers I can't imagine what they're dealing with. Let's just be kind. I know everybody's so really stressed out with what's going on, and support one another through this, because we're only going to get through this by working together. Thank you, Edson.